So to start tonight's discussion, I'd like to ask Jennifer first, what kind of health impacts are we seeing right now as a result of climate change across the state, and who would you say is most affected?
So the health impacts of climate change are myriad and manifest in a variety of ways. For example, issues such as air pollution and extreme weather events such as heat waves, wildfires, hurricanes, and floods are associated with heart disease, lung disease, for example, asthma, early death, heat stroke, kidney disease, infectious illnesses, whether they be waterborne or vector-borne, but also a range of impacts from mental health to direct injuries, displacement, migration, implications of access to food, quality nutrition, clean water, medications, health services. So as you can see, impact is far-reaching, complex, and intertwined with multiple systems. And as you might imagine, given these issues, the most vulnerable among us are more affected: the elderly, children, underserved communities, for example, BIPOC communities. And these are issues of social and environmental justice. In fact, there's a recent UNICEF report entitled "Climate Change is a Child's Rights Issue." So while climate change has direct effects, it also has what is described as a threat multiplier.
Yeah, that's you just kept listing all the different impacts, and I think it's something that we're still learning about, but it's also something that people need to learn more about. Like it's something that researchers are still looking into, but as the public, we're still finding out, and it's like you said, it's so far reaching. So some questions now for all of you panelists. How do the health impacts of climate change influence your work? For example, how does this issue pop up when you're just going out, when you're doing your everyday work in your office? DeAndrea, can I start with you?
Yeah, so from a policy perspective, it definitely impacts my work, or at least the lens that I try to look at for some of the work. In that I currently serve on our Agriculture, Environment, and Energy Committee in the State Senate. So as you can imagine, a number of the bills do have some type of intersect with climate. And as Jennifer so carefully laid out all of those examples, is really hard pressed to find something that doesn't intersect with climate in some way, whether directly or indirectly. And so that is definitely, as we are trying to evaluate policies or thinking about things such as one of the bigger pieces of legislation that had a lot of conversation around it was the Farm Act. And there was conversations about the hog lagoons and, what types of digesters, and is that doing enough for the local community, and what that greater impact can be. And so trying to think about that in terms of the way that we advocate and eventually vote, which I was a no vote for that, definitely plays into the lens for that committee. And I will say that many times, even with feeling like I have a pretty good grasp, there are still things that can come up that you may not had considered. And I really appreciate the many researchers and advocates who work on the issue, because they help to bring more of those things to light, ranging from even from in the healthcare committee, understanding how, climate and air pollution impact, infant mortality, or the birth weights, and just so many things that it touches. So I think it's more of, as I do that work, trying to have that lens and thinking about some of the externalities that our work could potentially impact.
Sarav?
Yeah, that's great. I want to pick up on some of what Senator mentioned just now in terms of where the impacts are, and specifically looking at different aspects and connections to air pollution specifically. So I'm a researcher, and I study air pollution and the impacts both on human health as well as on the climate. And one specific focus I have of late is trying to see what are the necessary tools that we need to understand the impacts of air pollution, impacts of emissions, and the impacts of climate on human health, and focusing on the transportation sector quite a bit of late. And so two specific sectors I work with of late is looking at the on-road transportation sector and trying to see how, as we decarbonize the on-road transportation sector, what are the potential benefits, and specifically looking at where we may have potential disproportionate exposures, and if those disproportionate exposures are being addressed as we decarbonize. For example, when you have a lot of trucks and they have a lot of emissions, and then as we electrify the trucks or the both medium and heavy duty trucks, to see if we decarbonize the emissions from trucks by moving to electric vehicles and are battery operated, then where are we getting the benefits? Those are kind of the questions we are asking and seeing how we can perhaps make sure we're addressing where we have disproportionate exposures and then improving the quality of life for them. And similarly, the second sector is also looking at quite a bit is the aviation sector. So aviation, of course, has both climate impacts and air quality impacts based upon where the planes are flying. And there's a lot of emphasis on decarbonizing the aviation sector by transitioning to alternate jet fuels, for example, instead of using petroleum-based non-renewables. So then we're trying to see how, if we decarbonize the aviation sector, are we also having co-benefits from an air pollution perspective? And that's where a lot of focus is.
Jennifer, what kind of impacts do you see every day?
I really appreciate sort of the allusions to lens and the complexities too of these. So, well, in the clinical realm, certainly our patients experience these impacts, as I mentioned before, asthma flares, heat vulnerabilities, mental health stressors. And I think we always have to see our patients as whole people in their context, or as I often think about it, in their ecosystem. So I think it's important for us to reframe our approach to care in this way. So we look beyond simple prescriptive approaches and consider these commensurate foundational needs, as we mentioned earlier. Another way to think about climate and health in our clinical setting is climate-informed care, as described by our colleague, Dr. Rebecca Phillipsborn. I also work in an educational environment, so endeavor to raise awareness of these issues with students, trainees, and colleagues. And then I'm grateful to have opportunities to have transdisciplinary collaboration in this area.
Senator Salvador, to touch on something you said earlier, you were saying that in your work through committees and various bills that you will be presented with climate impacts that you hadn't considered before, that you didn't think that climate had really anything to do with it. Can you give me an example of something like that where an issue popped up and it surprised you that it was related to climate change and health impacts?
Yeah, I'm trying to think because we have so many that we cover over the year, and we're finally, hopefully, coming towards the tail end of a very, very long session. But I think it's just like when I mentioned earlier, and part of it is members, so Senate members and House members educating other members. Some of those things with the with reports that come out, and I'll say a lot of it. Once you hear it, it makes perfect sense. It's common sense, but it's kind of a through line that kind of hides in the background because of our day-to-day lives. We don't really see it or think about it. For instance, when we are thinking about the New York Times report that came out a little over a year ago, and it was talking about redlining and how redlining has historically, we know what that has done for housing, but also what has that done for urban heat island effect and tree canopies. And that both has a climate impact, but it has a very direct impact in health, because you will also see in those same communities heat illness, or if you're thinking about something for elderly programs, it just all very much overlaps. So while I can't think of a specific, I think it's more of as it comes up or as new research comes out, particularly like if an advocate is bringing that, you can quickly see it, but a lot of it certainly kind of hangs to the back of your mind, because I just think day to day, even though we're experiencing these things very directly, because we're so used to them, I think it's very easy to not kind of put all the pieces of the puzzle together. So those are a couple ways, and I'm happy to kind of circle back once I maybe look at some of our committee bills. Our energy committee hasn't met in probably a little over a month or so now as session wraps up. So I'm happy to kind of circle back, but that's kind of just the theme that I've observed, particularly in that committee.
Yeah, I'm glad you mentioned urban heat islands, because over here in the Triangle in Raleigh and Durham over the summer, there was a project to map urban heat islands. So I believe it was one of the partners was like the Durham Museum of Life and Science. So I think they should be getting that data soon, and then local leaders are supposed to look at that data and hopefully implement policies to address it, like planting more trees, like you mentioned. Jennifer, you also said, you know, when you're treating patients, you really have to look beyond the simple, just prescriptive approaches. It's, you know, you have to take more of a holistic view. And you said something that I'm actually not too familiar with. You said climate informed care. Can you talk a little bit more about that? Is that like a specific practice? Is it an emerging idea?
Yeah, I would say it's emerging. We talk about things like trauma informed care, and what it is sort of holding this perspective as we hear our patient's history and think about the different aspects of where do they live. For instance, when we talk about redlining, are they in some of these communities that were disrupted by roadways, so that sort of notion. Yeah, and I love the fact that you mentioned the heat mapping, because I think we met there actually.
Oh my gosh, did we? I'm so sorry.
No, I was thinking like, I think we met there. And actually one of the directors of the study is going to be joining us in a class tomorrow evening that I'm doing.
Oh, great. Perfect timing.
Interdisciplinary graduate healthcare students. So
that's so cool. I'm sorry for not remembering.
No, I was thinking myself like,
one more thing, you said that because you also work in an educational setting, you have the opportunity to educate students and people training and colleagues about, about this climate informed care, or about taking this holistic approach. And I'm curious, when you talk to people about taking this more holistic approach, how do they react? Like, what is the overall sentiment in the healthcare community about starting to adopt these kinds of perspectives?
I think it's growing, and it depends. Like, so for the National Academy of Medicine, actually, in the last year or so has really focused on this. They've spent about 2/3 of their annual meeting last year emphasizing it, and is increasingly vocal. So we have that level. And then as I bring it, we're incorporating it into the medical curriculum. Stephanie Johannes, who wasn't able to make it this evening, is starting to do that. She's working with our pediatric residents during their community rotation and I think that as DeAndrea said, it's common sense. And so I think people, we're just helping them connect the dots. And it is so integral. It's not separate, right?
Yeah, no, it's absolutely all connected. Like you said, DeAndrea, once you start to actually think about it in that way.
Yeah.
And some questions for you, Sarav. You were talking about some of the, that right now you're really focused on researching in the transportation sector, you said the on-road, like cars and trucks, but also aviation. What has your research shown you so far about how all this development with roads and airports, and how all of that transportation development, how has all of that impacted climate change, and then as an effect, health impacts?
Yeah, so transportation is the largest contributor to greenhouse gases, right? Globally and within the US as well. The industrial sources were dominating till some time back, but then more recently, the transportation sector has taken over as the largest contributor to greenhouse gases. So from the work we are doing, focusing on, again, transportation, air pollution, climate, and health, We are seeing that as you look at decarbonization of the transportation sector, for example, the on-road sector, the cars and trucks, you also have co-benefits related to air pollution and health. And we quantified this for about 12 different states in the northeastern US plus mid-Atlantic states. North Carolina was not part of that in that particular study, unfortunately, but anyway, we did quantify that. And we showed that as you decarbonize the transportation sector based upon this climate initiative, you have about 7,000 premature deaths being avoided. Are the benefits that you have based upon this decarbonization of the transportation sector. So that's the kind of benefit that we showed. And then looking at the aviation sector, that's a little more complex issue. So there's a lot of momentum discussion to decarbonize the aviation sector, specifically by moving towards alternate jet fuel. And with the alternate jet fuel, which is mostly from natural sources, you are reducing carbon completely. And the recent Biden initiative to produce about 3 billion gallons of alternate jet fuel in the next few years is, I think, a big step. But then what we found from our research was, as you decarbonize or remove and move to alternate jet fuel, you are reducing some of the precursors for fine particles. These are really, really small particles that are formed in the ambient air based upon air pollution and processes. And these, when the humans inhale, they go deep into the lungs, and they have all kinds of health impacts, similar to what Jennifer talked about early on. But the point is, from our research, we found that even though you may be addressing carbon, you may be addressing PM, there is another component of air pollution, which is NO2 or nitrogen dioxides, which is not quite addressed. And so there's a recent paper that came out from our group, which showed that even as you decarbonize and move towards sustainable aviation jet fuel, you have a substantial component of adverse health impacts from air pollution from the aviation jet fuel, which is nitrogen dioxide. So that's a significant impact that needs to be looked at. So what that motivates is looking at combustion in the aircraft engine and seeing how to make this more efficient and reduce combustion-based nitrogen dioxides coming from the aircraft exhaust.
Yeah, that's definitely a lot to think about. And I'm glad that you're working on that research, because like we've been talking about, it's something that needs to be looked into, and we need more information to properly address it. I have my next question is for all of y'all, and it's kind of a two-part question. First, how are each of you addressing the health impacts of climate change through your work? What actions are you taking to try to address this problem? And secondly, for the people who are listening to our discussion tonight, what can they do to help address this issue? I'll leave it open to whoever wants to take that first.
I can start. I'm sure other panelists have some ideas too. So from a personal perspective, some of the very individual actions that I do is trying to, on a personal front, look at what are the climate-friendly actions that I can take, starting from, thinking of driving a hybrid vehicle. I don't have an electric vehicle yet. Hopefully that's something that I'll get hold of very soon. I drive a hybrid vehicle, and then when I buy appliances, I look for Energy Star labels. And then more importantly, or an easy solution, is to see how we can heat and cool our homes more efficiently through smart devices. And that's a significant source of energy demand globally and within the US. And that's something that all of us can think about and see how we can heat and cool our homes a little more efficiently. This is what we do. And in general, look for switching to green power. And one other specific action I think of a lot is to buy local, okay, instead of buying something from remote. And there was a study which showed in New York City, Amazon was delivering, I don't know, 1.5 million packages per day in the city alone. If you think about the amount of carbon that goes to bringing those packages from wherever they are and then getting all that people have to do. So think about how to buy local, both in terms of what I consume and what I do for my own family. So that's something that I think about. And one other specific ask or a suggestion I have is, as what I would recommend others to do, is to just start talking. I think more than anything else, besides some of the actions that I mentioned, just start talking with your friends, your family, your colleagues and neighbors about the urgency of the issue, which is climate change and human health, and bring a momentum through just plain conversations. Okay, this panel discussion is a great one where we're all talking about this, and people are perhaps listening to some of these topics for the first time. So one specific suggestion I have is to start talking more and more about the issue.
I think that's a good goal. Jennifer, do you want to tell us about your perspective?
Yeah, I agree with much of that. So where to start? So I guess I think in terms of just generalizing, who do I want to be and how do I want to carry myself into the world and my interactions with it. And so I think, I'm not a perfect human being. So there are things that but I guess in addition to what Sarav said, I would talk about like a plant-based diet, right? So in my world, that's a healthy thing to do, but it's also healthy for our planet. As an additional example, educating, we've talked about some of that. We just saw some award-winning youth leaders, right? And we're hearing at COP26 about our youth. And so they're certainly inspiring and amazing, but I think we also have a responsibility to support them actively and not just say, okay, well, our youth is doing it, but so intentionally engaging that would be something I just would add. And I think that all of us, there are many levels. We've talked about many levels of engagement, whether it's policy, advocacy, or these individual practices. And I think these are questions we can all ask ourselves. We all have different styles of engagement. And so I think about those personal actions, whether we walk more or we eat locally, but also what is our style, but how can we stretch ourselves? So for instance, these public forums, that's a new stretch for me. But so how do we challenge ourselves?
DeAndrea?
Yeah, and I appreciate both the comments of Sarav and Jennifer, and I definitely agree there. I mean, for me personally, I go to Raleigh every single week for the legislature from Charlotte. I take the train. We're a one-car household family, and it's both for environmental and because honestly, I think a car, if I had it, would sit in a garage or on the street 95% of the time. And I don't think it's efficient in a lot of ways, just in terms of utilizing a resource. I think transportation as a whole, we have to think about how to make that more efficient, just period, from a lot of different standpoints. And, like Sarav, I do have smart technology in my house that allows us to do certain things. We've participated in demand response programs, which can be really helpful during those peaks, which actually, our biggest peak in North Carolina is wintertime, but still those summer peaks, when they have to utilize peaking power plants, can be very highly polluting and can, contribute to overall rising costs. So those are some things, but, I'd be remiss to say that, the biggest impact is really, through our government, through our corporations who are, large energy users. And so, I will continue to look for ways that we can drive that, because I think that's where we are going to absolutely get the most return. Not to say that us as individuals can't be responsible. I think we should. I think it's a great thing for us to collectively partner on and do, but we also have to realize that it's a little bit of an 80-20 rule. There's a few entities that have a really big impact, whether that be transportation or, just utilizing in whatever industry. And so we should focus there as well, to help those folks move along so we can see the goals that we need to see.
And as far as, addressing the health impacts of climate change through your work, I think, all of y'all are in different sectors, different industries. Jennifer, you're an educator and an actual physician. You're actually working in a medical office. DeAndrea, you're in policy. Sarav, you're also in education and you're in research. So are there other ways? Let me rephrase that. What other industries, what other sectors can try to address these health impacts caused by climate change? Or is it another one of those things that it's every industry, it's every sector, it's just about thinking about it in that perspective?
Yeah, I'm happy to take a try at that first. I would agree with you, Celeste. I think everyone plays a role, and it's about, figuring out the maximum benefit within all of our roles. And so, in my previous work at my nonprofit organization, we really tried to look at, as Sarav was pointing out, to those, multiple benefits from doing a certain type of program, in just figuring out how we played a role. Though our organization wasn't focused on health, we were very aware that if we were able to partner and do an energy efficiency improvement, that can also have positive indoor air quality benefits as well, because maybe the house is less drafty, less likely to have mold. There is certain, just stress related or mental benefits as well from just being able to have a home that's comfortable, but they can also have a few steps to better controlling cost. And so though our organization, if you looked at our mission, it didn't directly say health in it, we still very much appreciated the role that we played. And I think that's for us as individuals, but also for other people in their respective roles to, as more information comes out, Clean Air Carolina is a great source for kind of piecing those things together. They have medical advocates for healthy air, and others that, you can look to maybe get a deeper lens for how you and your work can intersect. But I do think we all can play. It just looks different for each of us.
And it seems to me, and y'all can correct me if I'm wrong, but it seems to me like a big theme of our conversation so far that I hope people listening can take away is to really start to apply this climate perspective in everything and anything that we do as individuals, and even in where we work or how we work. It's really just about starting to take that holistic approach and take that perspective of how does this impact the earth, and how does this contribute to climate change, and what can I do as an individual to try to alleviate that. So would you all agree that it's really just about starting to adopt this perspective as we move forward?
Yes, and also just seeing ourselves as connected. The other thing I think I would add is listening and community. I think we've alluded to that, but we talked about redlining earlier. So it's not a matter of one of our professional sectors coming in, but listening to different community organizations, whether it be just a local region
Or CleanAIRE
there's
NC.
faith-based organizations who are green the church. So there are lots of segments who have these authentic relationships and know what their communities need and know what they're particularly experiencing. And so I think we have to make those connections as well.
Thank you for that, Jennifer. I agree. We have gotten some really great questions from the public, people who are listening. So I'm gonna go ahead and start. Our first question: if you could wave a magic wand and implement one policy to address all these issues, what would it be? Sarav, can I start with you?
Good one. Thanks for the question. I wish there is a magic wand, but let me expand on that a little bit. I think given the complexity of the problem that we have in front of us, I'm not sure there is one magic wand. This is going to take multiple approaches at different levels to really address the problem. But since the question is asking for a hypothetical magic wand, I would say that's turn off fossil fuels. I think that's the number one thing I would want to go for. But how do we do this? That's why it's going to take a multi-pronged approach to address that.
And turn off fossil fuels and move to renewable energy sources. Yeah,
from everything that we do, if there were no fossil fuels, there's been unequivocal evidence that fossil fuels, specifically carbon dioxide, is what is causing the long-term climate change. So if we can move away from use of fossil fuels, I think that will be the number one solution, and that's where we need to make a lot of progress. There is progress being made, but there's more to be done. So that would be my wish list in terms of what the magic wand would contain.
I agree, though, that it's such a multi-pronged, multifaceted approach, because you say fossil fuels, but it's everywhere. It's kind of like it's in everything that we do, whether it's cars or generating electricity, or you were talking about the petroleum fuel that airplanes use, like it's so integrated into our society. So now we have to undo that.
Yeah, that's why, you know, the thought about it's going to take a multi-pronged approach, but still, if you want to really hone in on one aspect with my magic wand, that'll be turn off fossil fuels and move to renewables. Yes.
Jennifer, what would you do with the magic wand?
Part of me wants to say something very practical, a little more practical, but also my real magic wand is more philosophical in that for all of us to see ourselves as more connected as a whole, and ask ourselves what is enough. Because I think that notion of enough is important. In a practical, tangible way, I would say that the health sector is a huge contributor to greenhouse gases. And so I would get the whole health sector to really buy in.
And sorry, when you say for the philosophical approach, when you say for us to think about what is enough, what do you mean by that? Enough in what sense?
Enough that we don't have to have huge homes, and we don't have to have we don't have to fly everywhere. We don't have to have more.
I see what you mean. Okay. And also I'm kind of honing in on the philosophical part of this, because I think it is important. When you, and you mentioned this earlier when we were talking about feeling like we're all connected and that we're all part of this community. And correct me if I'm wrong, but it feels like you're saying that there may be some people who feel like climate change applies to those people over there and it doesn't apply to me. Is that, would you say like that's part of the problem, that we're all here on this earth and climate change is going to affect all of us equally, and every single person, regardless of any kind of division, we need to come together on this?
A little bit of both, right? So I think there are those of us who live more privileged lives, and we think of that being over there and not think about this being and then I mean all connection to the planet. There's this concept of planetary health as well that I think is really foundational. So if we care and we find that balance with our planet, then intrinsically we will care for each other, be they human or animal, because it is in truth all connected.
Thank you for that. And DeAndrea.
Yeah, I mean, working in policy, I can't tell you how much I would give to have a magic wand. That would be my number one wish if there was like a genie in a bottle. I think to be able to have a magic wand for policy. But you know, as Sarav pointed out, it's a very complex issue. To kind of bring it back to home, the closest that I think we have seen in the US to date would be the Build Back Better Act. You know, it does have a number of key provisions, and I say all of that to say it's still, you know, it touches a lot, but there's still, even within that, there's more. But, you know, it looks at, you know, our agriculture, it looks at it from a jobs perspective, energy efficiency and electrification. It has some transportation components. You know, it does look to be a more robust and further in terms of like a climate bill, you know, looking at, you know, clean electricity and how to create a nationwide standard for that to really move us along, implementing, you know, funds to help with lowering the cost and really getting us there in a thoughtful manner. So if I was to look more tangibly at maybe some of the things nationwide, that would certainly, because we do need to think about this from a federal perspective. We're talking about a really large challenge ahead of us. I mean, we have to think about from an international perspective. That's why everyone, or a lot of folks, are in Scotland right now. So from federally, I think that is something that, you know, I hope we can see key provisions of that move forward. Yes, we got the infrastructure bill, and that's great. But, you know, there's even more we should hope to see in the near term.
And DeAndrea, staying with you, we have our second question from the public. How do you view the challenge? How do you view the challenges and opportunities of cross-sectorial climate action from a health equity perspective?
Yeah, and so cross-sectorial, is that looking at industry, or I just want to make sure I'm looking at it from
different examples including housing, transportation, healthcare, disaster management.
Yeah, I mean, it definitely all goes together. So, you know, if we're talking about resiliency, for instance, and we're looking at a coastal community, you have to think about a lot of things that they may be facing. So if they're coastal and rural, they might be more likely to live in manufactured housing, which can have difficulty withstanding storms, but they also might be a last of the line community, whereas literally, you know, physically for the utility towards the end of the line, and it's more difficult to get those folks reconnected. And so there's a health impact from when that storm comes and they're without electricity for a prolonged time. And so, you know, I think it absolutely intersects, you know, even from the standpoint of our state budget, you know, things that I'll be looking at will be, of course, the very tangible energy or climate related spending, but it'll be other things like how are we just helping to improve our housing stock in a way that can help to do both and things of that sort as well, because they definitely very clearly overlap. And even from transportation, we know that this is a, you know, a huge source of emissions for our state. And as we are reimagining it, is there ways that we can also make it more equitable? So, you know, helping to come up with last mile solutions, things of that sort, would be just various lenses. And to more tangibly, one of the pieces of legislation that I filed was looking at an energy resilient NC, which, you know, very candidly, it didn't move as much as I would have liked it to, was really looking at how can we use funds to help drive local governments to look at microgrids that can be island off in case of, you know, extreme weather or emergencies to keep central places and communities connected. But, you know, I think other states are doing some interesting things that I hope that we can see here too. And I hope that, not knowing who asked the question, I hope that touches on it enough. And I'm happy to answer offline as well.
Jennifer and Sarav, do y'all have anything to add to that? It's fine if you don't. We have plenty of other questions. I can move on to our next one, which maybe Sarav, you might know some about, but it is for anyone who may know. Is there local health data that can be tracked in association with local sustainability initiatives, data that show us a before and after picture of health outcomes, so we gather evidence of these palpable impacts of these initiatives?
Yeah, I can speak a little bit since I do work with some health data. Perhaps Jennifer may have a lot more information than I do. Yes, under the NC tracks, that's a research initiative within UNC, they have these medical data from hospitals, right? And then that's a time series of data that we have for hospital admissions. And then based upon that, we can look at how things are changing over time. But I'm not aware of a specific data set over time for the entire state, if that's what the question is, at a high resolution, perhaps, you know, zip code or something finer than a county scale. At least that's the data that I've looked at a little bit from hospital, UNC and Duke, I think, with NC tracks. Jennifer may have more additions to that.
Yeah, I'm not aware of specifics to the state, but there certainly there is research and in localities showing, for instance, heat, tree canopy, and things like that. So,
do y'all think this is something that the state should invest in, this type of health database, to look at the before and after and to show us how well this one program did or didn't work? Do you think that's worthwhile for the state government or whichever state department to try to do?
Definitely, yes. I can give one example from some time back where they looked at this little bit from a historic initiative we had in the state. almost 20 some years ago, we had this Clean Smokestacks Act that some of us on the call may know about, where North Carolina had a very proactive historic act passed to reduce NOx and SOx emissions, nitrogen oxides and sulfur oxides from coal firing power plants. And it's a very historic initiative, and the law was passed, and then we reduced over the years emissions from various coal burning power plants in the state, which led to cleaner air compared to what was there before the act was passed. And then there were studies that quantified the health benefits of that particular act, and they said that 1,700 premature deaths were avoided based upon that particular act. So that was sort of the benefits that we had. So that goes back to tracking the population database in terms of what are the health benefits before and after. But I think given the emphasis on disproportionate exposures and equity discussions, I think we should have even more data collected at a finer scales across the state. And just county level is not enough. I want to go down to much finer spatial scales, zip code, census tract, census block, and so on, and really look at where we have higher exposures or higher health impacts and seeing how that is changing over time. So to give a short answer, Celeste, I think we should see who can do this at the resolution that will be really needed to quantify and track the impacts.
And when you say zip codes, it makes me think of all the data that's available for COVID-19 and how there are, like, it's possible. It's so possible for us to get these very finite data sets. I think it's just a matter of someone doing it. To move on to the next question, I think this is for any of y'all who can answer. Is there an opportunity when promoting sustainability initiatives to educate on environmental health awareness? DeAndrea, I see you nodding.
Yeah, sure. I think always, because as we spoke about, I mean, it definitely overlaps, so we've already talked about, if it was for instance, a tree-based organization, and they were helping to get this more equitably distributed for our tree canopy, they can talk about some of the benefits of having the neighborhoods, being able to be cooler, or like if you're painting tops of buildings white or something to make it more reflective. There's like some clear additional health benefits you could talk about. And so I think it kind of will vary depending on what that initiative may be. I know it might have been a while now, but there was for CleanAIRE NC, I know there was an initiative that was talking about like idle cars and idle school buses. And yes, this is very much a sustainability driven thing, but it's also very much talking about the health of those children that are playing outside and around those facilities. And so I think that was a really wonderful and tangible example to talk about how, yes, we can think from this global level, we can think about climate and the environmental impacts, but we can also think about those very tangible things too. So it will absolutely vary depending on the program or depending on the organization. But I think we would be hard pressed if we look very deeply to not be able to find some type of overlap that might be there that we might not originally be considering.
Jennifer, go ahead.
So the topic of health tends to bring people together. It's something that's shared. And so it can connect people who perhaps come from different perspectives. So absolutely.
Which I think ties into what you were saying earlier about, feeling that feeling that we're all connected to it, feeling that community sense. And I think we're starting to wind down our questions. Our last one, I think all of you may be able to answer this a little. The emphasis on renewables may dismiss their impacts. How do panelists prioritize reducing energy needs while maintaining quality of life by looking for new solutions and new knowledge? Sarav, can we start with you, and we'll just kind of have everyone chime in?
Sure. I'm trying to understand the first statement there. The emphasis on renewables may dismiss their impacts. I'm trying to see what the implication of that is.
Maybe in the sense, I can't see, I think it was Raquel Silva who asked this. the way I read it, I understand that maybe because everyone has been talking about the need to move away from fossil fuels and the need to adopt renewable energy, maybe it's starting to just become like empty meaning. Like people are starting, like the true reality of how important that is, maybe kind of slipping away from people. And they're kind of just, does that make sense? Like they're kind of not understanding the full impact of it. So you personally, how would you prioritize reducing energy needs?
Thanks for the clarification. I think I get the second part very well. I think that's a trade-off one has to evaluate in terms of how I or an individual goes about reducing your personal energy needs while also making sure you have the quality of life that you want. But I think that's a question of education. I think there are plenty of solutions out there. It's a question of good public education in terms of what are the benefits, where you're not necessarily thinking of this as losing a quality of life, but think really of the benefits. And I think that the climate and health conversation has evolved quite a bit to move away from looking at costs and really focus on benefits. I think we want to start thinking about what are the benefits of addressing the climate through, an example like moving towards renewables. There's plenty of literature that's coming out that quantifies the benefits of a climate action versus focusing on the cost part of the climate action. I think that's where I think a good public education or a press release, so to speak, from the powers that be, or people who do these things to make sure the public is educated is the way to go.
DeAndrea, how would you go about this?
Yeah, and similar, just if I don't properly capture the essence of the question, I'm happy to kind of track back and try again. I think Sarav is definitely spot on. For me, when I'm looking at it, it is trying to weigh cost benefit, and there are definite trade-offs, and the cost of renewables are definitely dropping, but you still have to factor in what are the costs of the transition, but there are a lot of costs for inaction as well. So more locally, the Environmental Defense Fund did a study for the state of North Carolina, and it showed, very tangibly what they expect some of the cost of like keeping fossil fuels for our state to be, and how it touched a lot of, the different impacts from health to cost to just pure, keeping people connected and the storm impacts, like with extreme weather. And so, and I'll be the first to admit it's difficult to lay that out and say that you have the perfect set of variables to absolutely know what everything will be. But, I do believe, and hopefully, like I alluded to with the Build Back Better Act, I hope that our federal government and whatever we can do to the extent of our state can help to smooth that transition, whether that is with tax credits or other services and assistance to really make that as levelized as possible. But, from our standpoint, is just trying to look at what externalities may exist and feel like we can, with the information we have today, try to make the best next step.
Personally speaking, I really want to transition to an EV, but I cannot afford it. So I think, if the state could do like tax, you were saying tax benefits or tax.
I did file some legislation for that. It's not looking likely this this session. I do think federally, I will keep working on it, but I've heard that both from the initial cost, but also just getting the equipment installed in your home and those costs as well, like to charge it. There's just different things I'm thinking about. I will say, I think more people at the General Assembly, like we have a number of members in both parties actually that own electric vehicles. So I'm hoping that we can continue that conversation and like you said, make it more accessible for all folks, and maybe and additional benefits for those who may be have even, like less disposable income to put towards it, et cetera. But because a tax credit, really can only help a certain bracket of folks, to a certain extent. So yeah, I mean, all of that to say, when I'm looking at it, it's just trying to balance out and make the best decision with the information in front of us.
Yeah, of course. And Jennifer, the last word goes to you on this question.
I, from a point of expertise, I don't think I have anything to add, but I would just say that there are so many people who do have expertise and also imaginations. I read a book recently called All We Can Save, which is a collection of essays and ideas from people in different sectors. It's just so eye-opening to see the different types of solutions that there are that we might think, oh, they would cost too much to do, but in fact, they have this enormous positive impact.
And our last, oh, I'm sorry, did I?
No, it's okay. I was going to add to what Senator was saying earlier in terms of EV. I think a significant additional need is the charging infrastructure. I can tell I personally, a few years ago, in a shop for a car replacement, I looked at EVs, but then there was some anxiety in my family about the range of the cars and then when I could charge and so on. So I think upgrading the state's charging infrastructure to go to these rapid chargers across the state and having more access to those is a significant, I would say, push that we need to have. And I believe that both with the VW settlement, the state is going to deploy more of those across the state, and with the new Biden administration's infrastructure bill, we may have more of this coming across the state. But I don't know the specifics of that. But I will tell that that's a significant aspect that people consider when they buy an EV, to see what is the range and how soon, how often can I charge my car when I'm on the road. So that's something that, Senator, hopefully, you also look out in looking at the legislation that you pass to see ensure that we have more access to chargers across the state.
I appreciate that. Thank you.
And we need to wrap up pretty soon here, but just quickly answering this last public question, with staying with you, Sarav, which we might have just answered. The first part is, has the North Carolina state government started its decarbonization efforts in the transportation sector, which I can answer is yes. The state, lots of different state agencies are in the process of converting their state motor, like their fleets, any state vehicles, they're in the process of converting those either into EVs or hybrid. So that's an ongoing effort. And question, so the last part for you, Sarav, what is the most, what is the most feasible decarbonization effort that local governments can implement in the near future?
I think that's a great question and a great point to bring up and discuss. So yes, I did hear that there's a state initiative to electrify all the state fleet. I think that'll be a significant push in terms of decarbonizing the transportation sector, because quite a few state vehicles are running around. But then beyond this, in terms of what the local government can do, we also have to look at the other fleet that are running around within the state in terms of personal cars and then the trucks. Trucks contribute quite a bit of carbon emissions, and we need to see how to decarbonize the trucks, both the medium and heavy duty trucks, to see where the opportunities are to electrify them. Okay, and that's where we need to see if there are interesting initiatives the state can have working with the local governments to see how this can be decarbonized or moved to EV in the near future. And as we do this, again, I want to go back to an earlier comment I made in terms of looking at where the benefits are in terms of trucking activity and then the local warehouses and so on, where the trucks come to idle and load, unload cargo and so on, to see if there is enough of emissions reductions happening where we have substantial emissions that are occurring as we speak with the warehouses and such.
And our very last question for the night, to leave us on a positive note, this is for all of you to answer. What are you optimistic about in the fight for climate action? What makes you hopeful moving forward? Jennifer, can I start with you?
Well, I think I mentioned a few things before. One is, well, I'll just start with the fact that I think we're talking about this, and it seems to be that there's more awareness and more discussion. So I hope that perception is true, and we talk about our youth and this movement and supporting that. So they're bright and they're passionate and capable and inspiring. So I hope we take that and run with it. And then we talked about the fact that there are solutions that are already extant, and we need to act. Yeah. We need to have the will to act. So
DeAndrea?
Yeah, I mean, really gathering, I think this conversation is growing and I hear it more. I see a lot of emails from constituents across the state that are climate focused. And I think that's really, it's wonderful to see people exercising their civic engagement on the topic, which is really important. And then, you know, I do have to say, like, I know for House Bill 951, it was a compromise bill. There was a number of provisions that folks wanted to see more of or didn't want to see included. But given the political makeup of our state, a mixed government with both Democratic leadership in the executive office and Republican leadership in our Senate and House, to have a compromise bill that came out of Republican majority chambers that, you know, did to some extent codify in law a climate goal. I do think that that is something to be optimistic about, because years prior, I think even that conversation was really difficult to have. And so while I can certainly understand with some folks, they might and absolutely are justified in wanting to see more, I think we can still be optimistic given that, you know, just a few years prior, if you told someone that North Carolina was going to say, you know, 70%, said to have in law a goal for 70% carbon reductions by 2030, net zero by 2050, it would be really surprising to a lot of folks, even including myself. So I do think that that is something to be optimistic about, because if we set that essential threshold, we can build off of it. So kind of thinking that we continue to put those building blocks in place. So that is something that I will say I'm optimistic about, is about having conversations, seeing people engaging on the topic, even for the folks who, and I did support that legislation, but even for the folks who didn't agree, I thought it was really important that they were being active, because it lets us know where do we continue to go from here. So that's kind of one thing that I will leave off personally with, that I'm optimistic that our state is continuing the conversation on climate.
Yeah. And Sarav?
Yeah, I think I want to pick up on what Senator said, which is more focused on the state. I want to step back a little bit and look at a big picture. There are 2 points that I've come across that make me optimistic to respond to your question. And the first is, if you look at all the climate discussion of the past several years and the IPCC assessment reports that have come out, the question used to be, you know, do we believe climate change is man-made or anthropogenic? That was the question. People were not quite convinced that was the case. But I think we are at a point today where that's not the question that's being asked. You're asking the question, what is the time scale of action? We are trying to see how soon we need to act. I think the conversations evolved quite a bit in terms of whether we question if it is man-made to now believing it's man-made, but then what is the time scale of action? I think that's a very powerful message that's come out in the conversations in the past few years. So that makes me hopeful on one front. And the second is a little bit from the COP26 meeting happening last week and this week, is specifically if you track the various countries that have pledged climate action, you see that about 130 some countries, which quantify about 70% of total greenhouse gas emissions on a global scale, have pledged net zero by 2050. I think that's a significant advance you've had. There's a lot more to go, but still seeing that countries that have about 70% of total greenhouse gas emissions have pledged net zero by 2050, I think it's a significant milestone. A lot more to go, but this still does make me feel hopeful, and we can perhaps limit our planet's warming to 1.5 degrees C by the end of the century.
Well, I think that concludes our discussion for tonight. Thank you so much to all of our panelists, Jennifer Lawson, DeAndrea Salvador, and Sarav Arunachalam. Thank you all for being with us tonight and for sharing your expertise with us.
Thank you.
To end the night, I'd like to hand it back over to June.
Thank you. Thank you, Celeste, and thank you everyone for attending our event tonight. Many thanks to our panelists for joining us and sharing the exciting solutions for the climate challenges we're facing in North Carolina, you know, how we can put hope into action, and also what are some new strategies for getting the health data out there. I thought those were all really, really good questions from the audience. So thank you to our moderator, Celeste Gracia from WUNC and for all of her excellent environmental reporting. So here's my last closing words. As you learned this evening, we have a lot of work ahead of us, but we're up for the challenge here at CleanAIRE NC if we all work together. And I've been working together with many of you for 16 years now, and I want to share some personal news. Next year, we will be celebrating the 20th anniversary of CleanAIRE NC, and I have decided it will be a good time to take my leave after 17 years as the executive director. So I will be, I don't know about retiring, transitioning away from a paid role here at the organization after 17 years. And so one of my goals next year is to ensure that we have the financial resources necessary to really expand our staff, our small staff, which will enable us to really move the needle forward on the urgent issues at the intersection of climate, health, and equity in North Carolina. And of course, we rely on each one of you to make an annual commitment to us to help us do this work on your behalf and on behalf of our children and our grandchildren. So if you haven't already, please make a donation tonight. We accept all levels of donation. And we want you to go ahead and make that commitment to help us reach our fundraising goal. We have much planned for 2022, from creating cluster networks of air monitors and environmental justice communities, collecting data to hold polluters accountable, to engaging more medical and health professionals in our advocacy for climate mitigation strategies like RGGI and much, much more. But we can't do it without your support. And I know you've heard this from many other organizations, and we're one more nonprofit, but we're a really important nonprofit and we need your support. So put us at the top of your list. Again, thank you in advance for your support. And I hope that all of you have a wonderful and relaxing and healthy holiday season. And we'll see you in 2022 hopefully at our NC Breathe conference, which we've scheduled for Thursday, April 7th. That's NC Breathe. The theme again will be health, equity, and the climate crisis in North Carolina. Thank you all so much and have a good evening.